my experience, we have half a parent who is already carrying the Li-Fraumeni syndrome, and half are first tumor event in a child. Nothing is very easy for parents, but I would say that when they know the variation in the family and they have time to prepare themselves and they choose with us to do a test to their children, perhaps it's not so hard because their parents have time to prepare themselves about the bad news. What is sometimes more frequent is that the parent doesn't want to do the test because they are afraid. So it's the role of the pediatric clinician to explain to parents that we have some surveillance program that can be proposed and help them to accept the test. In France, we adapt the European protocol of TP53 surveillance, and we try to do the more acceptable for children and their parents. So we decided to base this surveillance on the whole body MRI every year, and 6 months later, abdominal ultrasound in the same time that brain MRI. So that they have double check of the brain every year and abdominal check in ultrasound or MRI, whole body MRI, 2 times in a year too. It's not very different but European. It's just less blood and urinary tests. We start the MRI 2 times in a year with general anesthesia every time before the age of 4 or 5 years. It's not a problem for the children to have frequent general anesthesia because it is safe and adapt at the age of a child. I think the difference is very important between young children and adolescents, because young children, it's a problem of organization for the family and parents to be there. Teenagers are, I think it's more complicated to organize the planning because they have an exam in school, they have some organization in their life that can complicate the surveillance. But we need to take care and not to be too intrusive in their life. And even if we are very anxious about perhaps a risk of cancer, we don't have to speak about that every time. And I always say to my patient, no, it's prevention. So you are in a good health, and we are here to stay in good health.